China is the biggest country in Asia, and the Chinese thoracic surgeons cover the biggest volume of thoracic surgery in Asia. And we perform the biggest volume of surgical disease by uniport or other kind of VATS. We must have new ideas, like a new creation from other countries, from other city, other hospital. So we invite the speakers from the world, from Canada, from United States, from Europe, from other Asian countries. We want to exchange ideas, and even further, we want to teach each other and learn from each other. Especially for the young surgeons, as we all know, we have 300 or 400 participants. Over half of them until 35 years old. They are young surgeons, but they will grow up. They will be the pillar of the thoracic surgery. So we want them to learn a lot from different country, from different hospital, to reach the same level.
I think Diego Gonzalez-Rivas coming to Shanghai was a perfect marriage of the right technique with the right case volumes to quickly develop this technique. But most importantly, I think we have the right people. People like Diego himself coming to China, establishing the course, personally going to all the different hospitals, different cities to demonstrate the technique has been hugely influential. And he was supported by the Shanghai Primary Hospital, who are very keen to promote the technique, supported by the publication companies here in China, who were very willing to promote the literature surrounding uniportal. And also we had a lot of support from industry, who saw that with this technique, it's a perfect way to promote and to utilize their latest products, especially here in Asia. And I think the marriage of all these ingredients has contributed to uniportal VATS really booming here in Asia today.
Uniportal VATS is a new technique that really changed my life. When I was working in Europe a few years ago, I came for a course here in Shanghai Pulmonary Hospital for a training course, the first one they did. I stayed here nearly 18 months and I learned a lot. I was working hand to hand and face to face with one of the most important and more skilled surgeons in the world. And Uniportal changed my life because with this you can offer the best for the patient, and with less minimal invasive surgery you are doing the best surgery in the world.
I came here, I met the top surgeons in the world, the best ones that are definitely performing hundreds of cases every year, and I trained with them, and learning the technique from top surgeons as Diego, as Zhu Mingzhu, as Jianing Jiang, as Zhang Li, definitely opened my possibilities as a surgeon and definitely make me grow.
The Shanghai Pulmonary Hospital, the experience I gained here has been very fundamental for me in order to establish a uniportal VATS lobectomy program in my country back in Athens, Greece.
I think it's a fantastic opportunity that we can have an exchange of ideas, and this Congress is an example of this, what happened, and I think most probably Europe doesn't recognize how progressive is Asia and how advanced they are in technology, but in particular about the uniportal.
I think uniportal VATS is a less invasive surgery according to our data. Uniportal VATS is reduce the post-operative wound pain, and I have data related to wound pain data.
This is my second visit in Shanghai, and the reason why, because uniportal is progressing and we want to keep progress. And this is really the best place to pick up what's going on. And I must say that I think the Asia, in view of volume, progress and training possibility, will be the leading part of the world for this procedure.
For me, as a young surgeon in the beginning of his career, uniportal VATS is a way to go through for me, and it's my future, I think. I believe it's better for the surgeons, I believe it's better for the patients, and I think it's the best technique existed now in the thoracic surgery world.
It's an amazing symposium, and here surgeons from all over the world. We are talking about the uniportal VATS, the progress in the lung resections. I like this symposium.